Hi, I'm sitting here with Nancy Cauthren. She has volunteered to share the information about her care that happened with her. She has a very severe lower back condition called the Spondylolisthesis. Nancy, if you could just kind of give a brief description of what it was like before you came to see us, what your life was like on a daily basis.
Agony. Could barely move. Couldn't get down and play with my grandchildren. It was torture just to walk into a grocery store.
Yeah. Now, was that just an occasional thing, or was that just in the morning, or was it like an all day, all night thing? You never got any relief?
Yes, constant.
How much sleep would you say that you got on a regular basis, uninterrupted by pain?
Uninterrupted? 20 minutes.
So 20 minutes is the most you could sleep at any time?
Yep.
Okay. So we started your care. We used the instrument adjusting with you. We did a special type of drop maneuver to set the spondylolisthesis back in place, and went through some therapies for a while, some muscle relaxation techniques, the ultrasound, the stem, different things, and then we were able to get your pain to go away for a short period of time.
Yes.
Like overnight sometimes. So you could actually sleep.
Yes.
That was within the first couple of weeks.
Yes.
Now, after we did that, we started a rehab program where we started strengthening your spine and training your muscles to support the joints in the right position so that it wouldn't come out as frequently. Now, once we started that, you started to experience relief for a couple of days at a time. Now, we are completed with your stabilization phase of care now. How long does your relief last now after your treatment?
Pretty much constantly, as long as I'm doing my exercises.
So very rarely are you interrupted by pain, like maybe once a week, once every couple of weeks?
Maybe once every couple of weeks.
How much would you say that this has changed your life?
Drastically. I can play with my grandchildren, I can go to the grocery store, I can walk around the block with my kids.
Yeah, it's pretty funny when you look back at where you were and where you are now. How much would you say this changed your perspective on what you can do as a person with your life?
A lot more. 100%. I'm not going to be worrying about not being able to go to classes now and not being able to figure out, am I going to be able to sit through class without being in pain?
Yeah, so you actually are looking forward to a career now instead of wondering if you're going to have to be on disability for the rest of your life. Cool. And that's why we do the treatment we do. And thank you for taking the time to share your story with us so that other people can know that there is help for people with you. Even with a severe 40% spondylolisthesis, you can still get help without surgery, and usually the surgical option is a very viable option for the condition you had. A lot of people choose to have it, and unfortunately it has a very high failure rate, because once you fuse that joint into place, it's stuck there forever until you have another surgery.
Right.
And usually after they do it once, they don't want to mess with it anymore. So it's very nice to know that people can respond to this type of treatment without surgery and do great with it. So thank you for sharing your story. I appreciate it.
You're welcome.